I am Mr. Doctor, and today I will be your doctor, physician, healer, if you will, or if you won't. That doesn't really matter, I suppose. Anyway, how are you doing, champ? You good? Oh, you have a cold. Me too. I also have a cold. That's why I'm keeping my voice down, and my mouth is a lot more than usual. I apologize. But twinning, or losing, I suppose. But no, I'm not interested in talking about physical illness. Having said that, though, a colleague of mine, an associate, had tuberculosis, TB. I know, awful, real bad. But by the end of it, and they got better, by the way, by the end of it, abs of steel, like one of those old-timey washboards down there, you know. So, illness, it doesn't define you, but it can certainly define your abdominals. But anyway, no. I'm not here to talk about your physical well-being. I mean, you got a cold. I'm sorry about that, but if you weren't unwell, you wouldn't be here, right? I am, after all, a doctor. But no, I want to talk to you about your hair. No, about you, your brain, your cognition, your emotional well-being. I want to talk about that. So, how are you, champ? No, I know you got a cold. I got one too, remember? Losing, but no. How are you? How are you? Interesting. Very interesting. Oh. Well, it's a difficult time for everyone, isn't it? Do you find yourself being irritated, aggravated by small things such as chinchillas or Mini Coopers? Yes, I thought so. And do you sometimes find yourself struggling to see the big picture? You're right. The Mona Lisa is smaller than you think. And going to theaters is going out of fashion. We need to do something about that. Not today, though. Not today. Oops. All right. Tell me, Do you often sing or whistle just for fun? Very telling. Very telling indeed. And finally, do you think that you are happy enough? Do you think that you are happy enough? I see. Very, very interesting indeed. So, based on what you've told me, I would like to recommend talking to someone. If you ever feel overwhelmed, depressed, or lonely, try talking, even if it's just out loud first, or even if it's to your old pal. Mr. Doctor, what a name. But talking about it, vocalizing it can help make it real and make it something achievably resolvable, even if it can never necessarily be resolved. But if you're feeling extra overwhelmed, and who could blame you the way things are going, I cannot recommend more if you are able to speak to a therapist. If not that, just talk. That is my recommendation. Now, as for the cold, I think a few rounds of electroconvulsive therapy should help sort that out in no time. Wouldn't you agree? Oh, nothing like giving the old prefrontal lobes a bit of a kick up the cranial nerve, right? Oh, I'm gonna do it myself after, don't you worry. Now, I don't need consent written or anything. We have a doctorly agreement, right? Doctor to doctor. I think you'll get a real kick out of it. If not that, then a bit of a zap. A jolt. Volt. Either way, you're good for it. You want to have a go. Cool. Okay, so let me explain how this works. This doodad over here will be connected to a machine that goes on your temples, each side of the head. And when I pull that lever here down, it'll turn it on and you'll get a big old zap. I've heard it can be very relaxing. Help you forget your troubles for a bit. But, oh right, I should show you the new hat. Here it is. Pretty cute, right? Well, I know. It looks like I'm gonna kill you. You know, depending on how I go about it, I might, but that's not what this is about. No, this has connections here, you see, and here. And I turn those in, get them in nice and tight, and they go here and here. And then it sends the zappy zap through your brainy brain. How does that sound? Relaxing, right? Clear those cavities, those sinuses out. No trouble. Okay, so you may have noticed that the chair you're in is specially designed. It's got little straps and all sorts of things on it to help you stay relaxed. Now I'll have to do up those straps and strap this onto your head too before I screw in the doodads. Just in case you accidentally try to escape, you know? We wouldn't want that. It would ruin the whole session. We'd have to start again, you know? Alright, so first of all, let me plug this in, and then we'll get it on your head so that we can get started. Gotta connect it up. One in here. I hope I got them the right way round. It matters. Oh, and one in here. Perfect. Perfect. Okay, now I'm gonna put this on your head. Don't worry, you're gonna look great. How's that? Okay, good. Now I'm just gonna tighten up the straps around you. They feel tight? Perfect. And now on the old mitts, just down there so that you don't, accidentally escape. You wouldn't want that happen, would you? No. Alright, so left first. Is that uncomfortable? Perfect. And right. How's that? Uncomfortable. Perfect. Okay. Oh. You look a picture. Perfect picture. Oh, I almost forgot. Before I tighten up the doodads on your skull, I need to, no, don't worry. I need to wash up. Everything is perfectly sterilized. I put it in lukewarm water, like you're supposed to, for, 5 minutes or so. Run it under the cold tap, right? No, I need to put a little bit of water on each side of your head to help the conductivity. No, you're not gonna die. It's not an electric chair. It's an electric hat. The chair isn't connected to anything, apart from you. Alright. So I'm just gonna dab this with some water. Now. And just on the sides of your head. How's that? Nice and soft, huh? Seems cool. Cool and cool. Alright. And the other side. Oh, alright, the smooth side. Of course. How silly of me. Okay, and how's that? Oh, it's nice and cool, eh? Almost relaxing. Well, might not be with what's coming up next. Alright. There we go. Wow. Bet you're glad you came in today, huh? Now I gotta tighten up the old doodads so they touch the water. So they'll carry the current through your dome. All right. Can you feel the metal yet? It'll feel cold. A bit more. It's gotta be tight, you know. Perfect. Okay. And the other side. Let's get in there. Again, tell me if you feel it on the cold on your head, on the water. Yeah. Which way am I doing it? Is that getting close? All right. Yeah. That looks like a thing. I don't know. Well, I mean, how are you feeling? You doing okay, champ? You're doing perfect. Perfect. All right. Now, let's just... Oh, I almost forgot. This. No, it's not my underwear. It's, you gotta put it in your mouth and bite down on it, okay? It's a mouth guard. Yeah. No. It's to stop you from... if you get hungry during the ECT, you might try to, eat your own tongue. Don't want that to happen, right? I'm sure it tastes great. You'd know. Or would you? Oh, anyway, put this in your mouth. There we go. And bite down on that. The added benefit that now you can't talk back to me, right? Okie dokie. Now, I should have really offered you a cigarette first, shouldn't I? No, I'm not gonna kill you. Why do you keep thinking that? I'm a doctor, not a murderer. Executioner. No. I should have offered you a cigarette because I'm gonna have one and, take some notes while I keep an eye on you, make sure you're okay. But now you got the old tongue thing in. You can't enjoy it. I'm sorry. You can have one after. If you're able to, I suppose. Anyway. Oh man. Love being a doctor. Okay. Let's turn this on. Okay, make sure it's all the way down. And you'll hear a little zzz. Nothing I can do about that. So here comes the power. You shouldn't feel anything right away. Now you can see it's got all kinds of nonsense going on there. I don't know what it means, but basically I turn that up and then pull that lever and it zoot zaps your brain. And it should feel, I don't know. I've never done it. And I'll take notes with my pencil. All right, champ. Are you ready? Okay, let me turn this up a bit. Let's go for, that number. Are you ready? Seriously, I can't undo it. It won't be for long the first time, just to see. 3, 2, 1. Happy New Year. Oh. You good? I'm joking, you're not a crybaby. It was normal, just a little tease, a little test, just to see if you can handle the true hit, you know. Like good drugs. Oh, I could prescribe you some of those if you like. After all, I am a doctor. You liked it? Now here, let me put a little bit more water. Sorry about the smoke. A little bit more water. Yeah, okay. That's it. Better. A little bit more on this side. Better. All right. Perfect. Okay. Let's turn things up a notch, huh? You're not a toddler. That was a toddler's dose of electroconvulsive therapy. No, you want that new brain smell, right? A real fry job. Oh, that sounds gross. You know what I mean? Okay, let's turn it up a couple of notches here. Okay. You ready, champ? Oh, that smokes. Here we go. It's a lot of smoke. I think the boom will be running next time. Oh, I'm smoking. That's why. How silly of me. All right. I'm getting worried that this might not be as safe as I thought. Still, you're okay, chap. You're okay. How you doing, champ? How you feeling? Good? How did it make you feel? What did it feel like, out of curiosity? Like throbs, pulses. I see. Okay, let's put a little bit more water on there. You're ever so gentle, like. There we go, perfect. And the other side. Oh, wonderful. Let me tighten up those doodads a bit for you too, huh? Okay. Oh, on that voltage, I have to do a test. Yeah, the gloves are for me, not for you. Test. So I'm going to tell you a joke. You laugh or don't, it's up to you. If you find it funny, I would encourage you to laugh. Alright, here's the joke. The ego and superego walk into a bar. The bartender stops them and says, "Sorry guys, I'm gonna have to see some id." No, not funny. You're not gonna laugh at that joke just a little? Was it that bad? You're not gonna laugh. That's a very bad sign. I suggest we up the voltage and see if that can't improve your sense of humor. Yeah, why not? When in Rome. I mean, if you're smoking, I'm smoking. No, I know you're not smoking a cigarette. I mean, you know. All right. I think we need more of a zap. Let's go halves on this one. You ready, champ? There. It's okay. Oh, it's okay. It's okay. How you feeling? Makes you feel better, right? How does it work? That's the magic of it. Nobody knows. One of the world's greatest mysteries. The pyramids. Stonehenge. Western democracy, electroconvulsive therapy. Kind of all the same thing, if you think about it. But you're feeling okay. You're good, right? I wouldn't want you to, die or anything. And we don't want to do so much that that new brain becomes a, lobotomy. Although, if you're looking for a lobotomy, I have very affordable rates. No? All right. We'll stick with some water for now, Little taps make you feel better, cool you down a bit. Hard work, getting electrocuted. How's that? All right, and the other side. Perfect. You want your doodad screwed? Well, that didn't sound right. How's your boxing chomp? Good? I don't know, it's like they loosen up. Maybe because of all the shaking around, the convulsing, and the sheer agony. You haven't tried to accidentally escape, have you? Good. All right. Shall we? Or shall you? Let's ramp it up to... Yeah, why not? Better you than me. Bon voyage. Oh, sorry about that. I almost forgot to flip the switch. How are you doing? You feeling more relaxed? Of course you are. It's ECT, baby. All right, a little bit of water, and then we'll max it out. All right, here we go. A little bit there, like that. And a little bit there, like that. And the doodads. Gotta do the doodads. Always forget the doodads. All right. Here we go, all the way to the top. Penthouse suite. Pure bliss. Nirvana. You ready? Go get him, champ. Champ, you're finally awake. Oh, here. Let me take that. Better? Hey, I thought that you bought the farm there, on the agricultural sense. Here, let me get these doodads off you. Why you got all these doodads? Let's get you out of this. Who put you in this, huh? It was me. Okay, and there we go. See? You're okay. Oh. Oh, no, no, no. Here. See, fine. thought I'd lost you. I thought I'd gone too far with the faults. That's me, though. Classic Doctor, Mr. Doctor. Now, be honest with me. You're cold. Cleared up, right? I knew it. But you feel a little more relaxed, too, huh? Doctor does it again. Oh yeah, it should be Doctor, right? Anyway, I'm glad I could help. Give you that new brain feel, huh? And you didn't even lose any life. All right. That'll be $30. Non-negotiable. All right. I should really charge up front, but I'm not a very good businessman. I'm not Mr. Business today, Mr. Doctor. Anyway, if you ever want to come back to get rid of another cold, you know where I am. But also, if you're not feeling very happy, we can just talk too. All right, champ. Now that you're all cleared up, all eked down, try this joke. Why did the Buddhist monk forego anesthetic pain relief during their root canal surgery? Because they wanted to transcend dental medication. It's a doctor joke. You probably heard it before. I probably told you before. You're not laughing much. That's a very bad sign. Maybe we should get you in for some more ECT. But for now, go your merry way, champ. And go get him, Tiger. Or my name isn't Mr. Doctor. Sorry, I was pretending to be a soldier. Goodbye.